close. So thank you. Coming from shoe throwing you, that was really hitting below the bell. I thought I was going to be rough, but obviously that's not the case. I can't compete here. So I'm going to try to advance it with my phone. Let's see if that works. How about that? Man, technology is something else. So this is my disclosure. So 5 years ago, Mark Frankel challenged me on this topic, and I thought we put it to bed. Clearly at the end of that debate, the humerus sit on top was the clear victor. But you know what? He is somewhat resilient, and so he imported Serena Namdari a couple years ago. And guess what? At the end of that debate, again, sit on top was a clear winner. So he's trying again with Brad, and Brad had some nice things to say about sit on top to begin with, and then he deteriorated rapidly. And then, of course, with the shoe throwing incident, that really is a final straw. So what you just heard was fake news, just to be clear about it. So the topic here is sit on top versus sit inside. You can see what the difference looks like here. So this is the best analogy I can come up with. I think some of you have seen it before. Do you like to sit on top of the toilet, or do you like to sit inside the toilet? And you can tell me who's happier there. Okay, so sitting on, looking at the world on top of the toilet is something that if you'd like that, you're going to like sitting on top for sure. Here's the argument. And if you take nothing else home, this is it. On the left, you'll see sit inside implant, which essentially medializes the humerus. A sit on top implant essentially lateralizes the humerus. And there's some good things about lateralizing the humerus, and Brad actually touched on some of it. One of them is it's easy, it's fast. Most important, it lateralizes the humerus. It's a common platform stem. It minimizes bone resection. It gives you better tensioning, and this is really important, better tensioning for the teres or whatever you have on the back of the shoulder, better deltoid wrapping angle, greater stability, a more efficient deltoid, a better moment arm, decreased stress on the acromion, and low notching rate. So if we look at the finite element analysis, you can see when you lateralize the glenoid, which is often coupled with the inset humerus, there is increased stress about 6 times more on the acromion as opposed to a sit on top. So let's look at this. One of the largest studies to date, we published over 4,000 patients. We had a 1.5% stress fracture rate, which is really low. Whereas a sit inside humerus has one of the highest stress fracture rates reported at about 10%. That's coupled with a lateralized glenosphere. So to confuse you further, not all sit on tops are the same. In the middle slide, you'll see the two superimposed. It depends on where you put the bowl. If you put the bowl, the implant I use, I put the bowl more medial, which essentially lateralizes the humerus and doesn't distalize it as much. So also, when you look at bone rib protection, sit on top implant, you take away less bone, as we've shown before. So disadvantage of sit inside, you got to remove more bone. You have less tensioning to the remaining cuff because you relatively medialize the humerus. You increase the stress on the acromion, particularly if paired with a lateralized center rotation glenosphere, which gives you a higher stress fracture rate, potentially. You minimize your deltoid wrap with higher instability in some systems. So in conclusion, if you like it easy, fast, you want to lateralize the humerus, low notching rate, great deltoid wrap, outstanding stability, efficient deltoid with low stress fracture rate, a common platform stem, and minimal bone resection, you'll like sitting on top. Or your choice, if you prefer to sit inside, you can look like this young child. So be a winner, sit on top, and Brad, go Gators. Make reverse shoulder arthroplasty great again. Sit on top. Thank you.